All right, if you don't know anything about Breathe Pennsylvania, I would like to introduce ours. Breathe Pennsylvania's mission is to empower Pennsylvanians to breathe better and live healthier through education and awareness of lung health in our community. We serve the western 10 counties of southwestern Pennsylvania, and we do have a secondary area that reaches a little bit further out. Some of our other programs besides this sleep group, we provide direct lung education, patient assistance, a school asthma initiative, sleep apnea education, tobacco cessation, and tuberculosis education. If you would like any information or more information on any of these, please feel free to reach out to us at info@breathepa.org. With that being said, our sleep group stands for Support, Lifestyle, Education, Equipment, and Preparation. And I think today's presentation hits on all of these. If you would like more information regarding our sleep group or sleep apnea in general, please feel free to reach out to me. My name is Allison Garcia, and I am the Program Associate here at Breathe Pennsylvania. My email is up on the screen, but if you can't remember that or don't have a place to write it down, you can send an email to that info@breathepa.org, and it will get to me. I am going to pass this over to Dr. Iregui from Pittsburgh Dental Sleep Medicine, and just give me one moment.
I am very excited to talk about lifestyle. Our lifestyle is our lifeline. And when I got into dental sleep medicine, I really didn't think about the fact that I would be changing or have the opportunity to change people's lifestyle. We think of, okay, well, we're going to treat sleep disorders and sleep apnea and breathing, but at the end of the day, it is very much connected. Our quality of sleep and our quality of lifestyle are very connected. And so my goal today is to just kind of dip your toes into how your personal lifestyle can be affecting all kinds of areas of your health. And there's going to be one particular word that is going to stream through this entire presentation. And I'm not going to tell you what it is, but I think by the end, if you guys want to put in the chat box what that word is, I'd appreciate it, because I just want to make sure it's really the key effect of poor lifestyle or healthy lifestyle, what the key effect is on your health. So your lifestyle is your lifeline. Again, I'm Chiarina Iregui. I practice dental sleep medicine with Pittsburgh Dental Sleep Medicine. Our practice was started by Dr. Rob Rogers, who I'm very honored and privileged to be part of this practice. He is actually one of the founding fathers of dental sleep medicine. And so obviously a huge impact, not just on my life, but on everybody's life who is dealing with sleep apnea and cannot tolerate CPAP. And so he is a huge founding father of improving one part of someone's lifestyle. So what's the definition of lifestyle? I kind of felt like lately I've been peeling away onion. I sort of think of things as, for me to understand them, I like to peel away at the onion. So the first layer is just understanding what lifestyle is. And basically the definition is the way a person or group lives. So it's everything, your activity, what you do from day to day, how you sleep, how you eat, the people you interact with, your stress level, all of these things that you do on a day-to-day basis, probably without even thinking, most of it is your lifestyle. So what is lifestyle medicine? It's the systemic practice of assisting individuals and families to adopt and sustain behaviors that can improve health and quality of life. Huge, not very many words in that sentence, but that sentence is heavy. There are a lot of things that we do on a day-to-day basis that affect our health and our quality of life. And again, the goal through this discussion today is to just touch the surface of some of the things that I would like all of you to be thinking about as you go through your day, and how each decision you make can positively or negatively impact your health. So we want to turn off the faucet. It's not doing much good if we're mopping up the water puddle and we don't turn off the faucet, because that faucet is going to continue to overflow. And conventional medicine, although I am a huge advocate of conventional medicine, I don't want that to be misunderstood. But conventional medicine, we've gotten to the point where we're very good at, surgeries and prescriptions and new medications, and how all of these things sort of change what's going on in the body to help make the body healthy. But again, all of these interventions are like mopping up the water puddle without actually paying attention to what's causing the water puddle. So lifestyle medicine and the choices that you can make on a day-to-day basis can actually help prevent the sink from overflowing. So instead of mopping, you're actually turning off the faucet. So daily habits. Like I said, we make thousands of decisions a day that affect our health. And daily habits have an influence on our life more than anything else in our life. And again, all these habits are choices. So today we are going to talk about what are the choices that you can make every day that can positively or negatively affect your health. So lifestyle medicine consists of 6 pillars. Those pillars are nutrition, exercise, substance abuse, healthy relationships, stress, and sleep. And basically all 6 of these pillars, they encompass what you do every day, and all 6 of these pillars are very synergistic. So if one pillar is out of whack, you can negatively affect the other 5 pillars. So let's talk about food, the SAD diet. It's interesting that the Standard American Diet acronym is SAD. So when you look at diet and you look at your nutrition, according to a lot of research that I looked at, about 62% of the American diet is processed foods, oils, refined grains, sweets, all those things that are not good for us. And we will delve into that just a little bit. The things that are good for us, and I'm sure that all of you have heard about plant-based diet. We're hearing more and more that a plant-based diet is the way to go. Plant-based diet only consists of only 10% of our actual diet. Now, I know if I think about what I ate yesterday, that falls right in line. Probably only 10% of what I ate yesterday, if that, was actually fresh fruits, vegetables, nuts, things like that are considered anti-inflammatory type diet. And again, with our busy schedules, more and more of us are eating out, and eating highly processed foods. So again, we will talk about how this affects our health short-term, long-term, and what we can do to change this. So the effect of an unhealthy diet leads to chronic inflammation. How does this happen? First of all, an unhealthy diet is high in sugar, which will cause a blood sugar imbalance. It's also high in omega-6 fatty acids. So we need to have our omega-6 and our omega-3 fatty acids need to be in balance in order to combat inflammation. Because a high processed food diet is high in omega-6, low in omega-3, it will promote inflammation. Also, artificial ingredients in foods. Our body reads those as toxins. And if we have toxins introduced into our body's going to react by trying to fight that toxin or that unnatural ingredient, which then leads to inflammation. The other thing I found interesting is we don't eat enough raw foods, and foods that are cooked at high temperatures produce an advanced glycation end product, which contributes to proteins that stimulate inflammation. So that was new information to me. Again, going back to raw foods, fruits and vegetables, plant diet, has a much less, or actually has an anti-inflammatory response in the body as opposed to foods that are highly cooked and highly processed. So our happy diet. Again, fruits, vegetables, whole grains, legumes. It doesn't mean that you have to be vegan or vegetarian. I certainly couldn't live without a good hamburger or steak every now and again. So we're talking about the majority. You want to think about increasing your consumption of natural raw foods in order to increase the health of the inside of your body by decreasing inflammation. I thought this was interesting, and I heard a lecture a few months ago where a lifestyle medicine physician said if on your packaging of food that you purchase has more than 3 to 5 ingredients, it is not a whole food. And if you start getting beyond 5 ingredients, there are going to be additives that, again, you're introducing something not healthy into your body and promoting an inflammatory response. So let's define inflammation. Inflammation is our body's response to a threat. A foreign invader, such as bacteria, viruses, we've all talked about that, particularly with the recent pandemic. It can also be our body's response to stress, whether it be physical or psychological. Our body is designed to send, as we say, an army of chemicals to attack any invaders. And this army of chemicals sets up an inflammatory response so that our body can heal. However, an inflammatory response is meant to be short term, which means we get through that illness caused by a bacteria or a virus, or we get through a short-term stress, and then our body can heal. It is not meant to be a long-term response. And in the case of eating a poor diet, if you are choosing poor foods day in and day out, your inflammatory response sort of becomes chronic. And then you start setting up your body for this continued inflammation response, which then, of course, sets up for diseases, which we'll talk about. So I just challenge you to think of one thing that you can do to incorporate a healthier diet. And again, I want to, as we go into these lifestyle, sort of the 6 pillars of lifestyle medicine, I am not one, if you tell me I had to change everything I ate today, and I'm not going to do it. I mean, it's very difficult. We need time to set up habits and practices and try different things that work within our lifestyle. So by no means, I always tell my patients, this is all a journey. And I don't expect you to turn on this switch right now and say, from now on, I'm going to eat a full plant-based diet. That's probably not going to work. You're going to set yourself up for failure. Then that causes stress and the whole cascade of that response, which we'll talk about shortly. So try to take it in little bites. What is one thing that you can do right now that you can start doing to incorporate a healthier diet into your daily routine? Once you've got that sort of mastered, then pick another thing that you can do. And over time, you decrease that inflammatory response. So now I want you to hold that thought. Let's get moving. So now we're going to think about incorporating a healthier diet. What about exercise? So it is no mystery or secret that exercise is very important to our health. The latest things out by the Academy of Sports Medicine and the CDC are 150 minutes of moderate intensity aerobic activity every week, and 2 times per week muscle strengthening activities. I do want to go into this part of the discussion with, I certainly you need to consult your physician when you start talking about exercise, because exercise limitations are specific for each individual person. So we want to keep you healthy, not cause injury or illness. So it's always good to consult with your physician for your particular health status. What is a good amount of exercise to start with? But this is kind of just a general goal that helps us think about, okay, what do I need to do to be healthy? So the benefits of exercise. Exercise reduces cardiovascular disease, which we know. It strengthens bones and muscles. It gives us a 50% lower risk of type 2 diabetes, helps control weight, improves sleep, improves energy, 30% lower risk of dementia, and prevents cognitive decline. So I want you to kind of think about that slide as we go into further into the 6 pillars of lifestyle medicine, because one of the pillars was sleep. One of the pillars was having good weight control and diet. So all of these things, again, we're seeing how interconnected these 6 pillars and each division or each thing that this 6 pillar helps you benefit from, how it helps the other pillars also improve. The University of California, San Diego came out with a study that basically said 20 minutes of moderate exercise stimulates your immune system, leading to an anti-inflammatory response. So that is key. Again, the take home from the exercise portion of the 6 pillars is just keep moving. Our society has too much of a sedentary lifestyle. We just need to move. For example, I'm always looking at my Apple Watch to see how many steps I do in my office a day, and it's not nearly enough, but I try to purposely walk into another office instead of calling on the phone, just so that I'm getting steps in, because again, we just want to keep on moving. So I want you to hold that thought. Stress. There's a common saying in my household that stress kills, and this basically came from my 6-year-old, my oldest son, when he was 6. I was upset about something. I don't remember the specific incidents. However, he just looked up at me and he said, "Mom, you're stressed and stress kills." Now that was my son as a young child. He realized at that time that stress kills. But why does it? When you're stressed, your body is going to go into fight or flight. So think about if a bear walked through your front door right now, you would run. Your body's immediate reaction is going to be, I either need to fight this bear or I need to run from this bear. And there's all kinds of things that happen physiologically inside your body. Cortisol, which is a stress hormone, is released, so that your ability to do things such as digest food or your immune system, sort of these regulatory things that occur just throughout the day, your cortisol decreases the energy that is given to those bodily functions, and it boosts energy to large muscles. It boosts energy to the heart to increase heart rate so that you can increase oxygen to your muscles so that you can get out of that stressful situation. Adrenaline is also released. This will increase your heart rate and breathing rate, again, to increase oxygen to the muscles. You also have stored sugars, and those are released to power your muscles, and your white blood cell production decreases, which decreases your immune system. So again, this is all meant to be short term. Now, what happens if we're in a chronic stressful situation, or the poor diet we eat is constantly putting stress on our body by increasing our inflammatory response? We start having chronic stress internally in our organs, leading to inflammation. So long-term stress leads to chronic inflammation. Most chronic diseases are triggered or exacerbated by a low-grade inflammation that stems from lifestyle choices. So those of you that are out there that are go, 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 I need to be accomplishing things, I have to be perfect at what I do, all of this stress that we put on ourselves leads to this constant low-grade inflammation. So the effect is far-reaching. Some conditions related to chronic inflammation are things such as rheumatoid arthritis, heart disease, inflammatory bowel disease, depression, diabetes, and the list could go on. I could do several slides of what type of conditions lead to chronic inflammation. However, patients that I see and I'm treating that have, obstructive sleep apnea, most people come in with at least 2 or 3 of what's on that short list. So what can you do to de-stress? Meditation is a great way. I know that, if I'm going through a difficult time and I just feel like I can't focus, I will put on a meditation app. I love the app Headspace. You could open up the app on your smartphone. It gives you different meditations to do through the day. There's one to wake up. There's one for energy in the middle of the day. They have different things you can do for exercise, of course, sleep. It is a great resource, and that's just one of many apps that are out now. Calm is another one that I've never used personally, but I've heard really good things about that. Exercise is going to help relieve stress. So exercise gets that blood flowing, gets oxygen, gets us using our oxygen. Exercise has that anti-inflammatory response, and so that will help relieve stress. Praying. I use prayer as a way to relieve my stress. I feel like if I've got somebody up there watching over me, I don't need to be as worried about what may not be going right in my life. And so it helps give me a sense of calm. Unplugging. This is huge, and we will talk about this further in our risky business and addiction. But we are all addicted to our computers, our phones, being constantly on a screen. And for many reasons, if we don't unplug, we are increasing our stress. I oftentimes feel like I have 1,000 things coming at me. I've got 2 email addresses. I've got my phone. I've got my FaceTime. We've got text. There's just too much flying at us. And so it is it's to your benefit to put aside computers and phones. I've heard some people say they do it on 1 day a week. I've heard some people say they do it after 6 o'clock, my computer and phone goes away. You pick what works for you, but that will help de-stress. And then, of course, breathing breaks. A lot of people have an Apple Watch or Fitbit that will sort of send you reminders. You can set it up to send you reminders every hour to take a breathing break. It helps get that oxygen. A lot of times we hold our breath when we're stressed. We don't have enough oxygen flowing through our blood. Taking those deep breaths has a huge effect on increasing oxygen to our blood system, and then increasing oxygen to our organs, and just having a sense of calm. So keep calm and hold that thought. Risky substances and habits are risky business. All of these things, some of them are toxins that we may be introducing to our body, some of them lead to toxins, and some of them just lead to an unhealthy lifestyle. So risky behavior keeps us from healthy lifestyle. It makes you more prone to inflammation. So as I said, anything that's a toxin, alcohol, nicotine, illicit drugs, they are toxic to your body, and your body will respond to those toxins by inflammatory response. Addictive behaviors will keep you from moving. How many of our kids are on their phones or watching TV or are gaming constantly? That has a cascade of effects. We're not moving. We're moving less as a society because of our screens. Where our kids are not getting outside to play. They think playing is being on their gaming device. One thing that absolutely drives me crazy, and we'll talk about this further in the discussion, is when kids say, well, I'm talking to my friends, and they're really texting. Texting is not talking. We're keeping on our screens and our phones, and it's decreasing our healthy lifestyle. So addictive behaviors keep us from moving and interacting with people in person. These addictive behaviors can also increase our consumption of caffeine, chocolate, different things that are unhealthy because we may not be sleeping if we have these addictive behaviors. And then we're putting in our system things to keep us awake, such as caffeine, high carbohydrate foods that will give us that increase of blood sugar to kind of keep us awake, not thinking that once that blood sugar depletes, we're going to plummet, and then we're going to be back to the caffeine or the sugar, the high carbohydrate diet. The other thing is that atmospheres that around risky behaviors, such as people who have a gambling addiction, they're going to be in a casino where there is smoke. So even if they're not a smoker, they're going to get the ill effects of secondhand smoke. Also, a lot of people in casinos are, drinking alcohol. So all of this, think about that all coming into your system and what your body's having to do to fight off these toxins is pretty astounding. So I want you to hold that thought. Social connection. So I alluded to this with the fact that we need, when we were talking about gaming and talking and our kids talking via text, we need social connection. And I think that if there's a lot of things that the COVID pandemic taught us, but I think one huge downside that we realized and why we had so much anxiety and depression during the time that we could not be with people was because we lost that social connection. So when kind of looking up about social connection and trying to find, really how to explain this, I found this statement from the Canadian Mental Health Association. Social connection can lower anxiety and depression, help us regulate our emotions, lead to higher self-esteem and empathy, and actually improve our immune system. Why is that? If we lower our anxiety and depression, we're going to decrease our stress, which is then going to decrease our chronic inflammatory response, and our immune system then will be able to be fed by our body because we're not pulling the resources from our immune system to deal with the stress. By neglecting our need to connect, we put our health at risk. So even though Wi-Fi and cell phones and Zoom meetings and such as this are beneficial, they do not take the place of one-on-one human contact. The lack of social connection leads to depression and anxiety, which we stated earlier. However, social connection boosts our confidence and mood. There was a study that I looked at that did a review of 148 individual studies, and it showed that people with a strong social connection had a 50% increase in likelihood of survival, which I thought was pretty interesting. It wasn't so long ago that this was the only type of social connection that we could have. And again, during the pandemic, this was better than nothing. However, because we are getting to the point now where we're out and about and people can interact comfortably, it is really important to remember that we need to include that in our daily life. The connection prescription, this was in the American Journal of Lifestyle Medicine, and I thought this sentence was very interesting. From the current body of medical research, it is evident that social connection has substantial impacts in many categories of our health, from weight management, diabetes, cardiovascular disease, cancer, and depression. So how does social connection affect your health? Research has shown that those with a strong social connection have a lower BMI. Studies have shown that individuals who suffer from diabetes, there was one study that kind of looked at, okay, we're going to take this group of diabetic patients, we're going to educate both groups on how to manage their diabetes. One group is going to go by themselves and kind of be expected to do this on their own. And the other is going to set up with a social group, and they're going to have a support system. And it was the people that had the support system that actually were able to drop their A1C and control their diabetes much more successfully than the group of people that were expected to do it on their own. There are studies with cancer survivors that indicate that people who are diagnosed with cancer have a much better chance of survival and successful treatments if they have a good social network because they feel connected. And also there was one thing that I read that it gives them a purpose and a reason to live. There was a study done on women. Women who have a greater social connection showed that these women had decreased risk of coronary artery disease, lower blood glucose level, lower smoking rates, lower waist-hip ratio, and lower rates of hypertension and diabetes. So social connection plays a positive role in our mental health, which then transfers into a positive effect on our physical health. So take a second just to yourself and evaluate your social connection. Some of the questions that when I was, again, as I was listening to this physician who specialized in lifestyle medicine, one thing that she said is a good predictor of human happiness is how you answer these following questions. What is your personal why? Why do you get out of bed in the morning? What gives you purpose and meaning? What matters to you? And where do you obtain your support? So now we're going to hold that thought. And we're going to talk about sleep. So sleep is again what I talk to my patients about every day. However, as I've gotten more into the poor health side effects from poor sleep, my discussion has started to bleed into what are these other things we can do in our life that will benefit our sleep. And then good sleep, how it bleeds into the other pillars of lifestyle medicine that will benefit and just all in all encompass better health. So how much sleep do you receive an average a night? Is your sleep restorative? Do you know why you sleep? And how does your sleep quality and quantity affect the other 5 pillars of lifestyle? So the activity of sleep. As recent as the 1950s and 60s, the belief was that sleep was a dormant state, that we just slept, everything shut down, nothing was going on inside of our bodies. Well, we have found recently, and it hasn't been that long that sleep medicine has actually been a specialty of medicine. We have found that during sleep, even though we're laying in a bed and we're virtually not moving or supposed to be moving, particularly in REM sleep, that our body is very active. So we're going to start with the brain. The brain is engaged in a flurry of activity. If we get good sleep, we get good number of hours and good quality of sleep, our brain's ability to process input increases. And I like to think of it as the neurons in our brain, they've been functioning all day. They sort of need to ring out at night. So they sort of constrict, they let go of the toxins that they've built up during the day so that the next day when you wake up and those neurons can sort of inflate again, they've gotten rid of any of those byproducts. We're not clogging them up. So you really need your brain to be in this flurry of activity and your neurons getting rid of their toxins. And this is a very active process. This activity can affect your quality of life by your mood, by your memory. There was a study that I read that showed that there was a group of people that received 6 hours of sleep, a group of people that received 8 hours of sleep for a consistent couple weeks. And then they were given new information. And a month later, the group that had the 8 hours of sleep had much greater memory of what that new information was that was relayed to them than the group that had 6 hours of sleep. So we're talking only 2-hour deficiency of sleep at night has a huge impact on what you retain. It also has a huge impact on your physical functioning. And I'm going to share this story with you. As recent as last week, I had been burning the candle at both ends. I talk to people about sleep every day, which is going to make this story very ironic. And I sort of chuckle at myself at how ridiculous this is. But I was really going on 4 and 5 hours of sleep a night for a couple weeks. And I have to tell you that last week, my mood plummeted. I was not in a good place. Everything was irritating me. And this past weekend, despite knowing I had a lot of things I needed to get done, basically my body shut down and I slept. I never sleep past 7 a.m. I was asleep until 10, 11 in the morning on Saturday and Sunday. I took a nap on Saturday. And it was amazing that on Monday, I felt like a completely different person. And, again, I just have to laugh because I talk to people about this every day, and yet I can fall prey to, I've got to get things done. I can, skip on my hours of sleep in order to accomplish what I feel I need to accomplish. And at the end of the day, it was very unhealthy. So lucky number 7. Adults need at least 7 hours of sleep a night. 7 to 9, but 7 is sort of that magic number. You need those hours in order for your body to go through the processes that it has to go through in each stage of sleep in order for all of these things that are listed here to happen, for your immune system to be boosted, for organs to repair, for you to maintain your mood and your memory, your ability to think clearly, your reasoning abilities, to give you energy, to maintain a healthy metabolism, and decrease inflammation. If any of these go out of whack, that inflammatory response kicks in. For example, last week when I was not in a good headspace, my stress level was exacerbated very easily. And what did that do? I was in that response of fight or flight much more frequently, which what did that do? Then cascaded into an inflammatory response within my system. So we've talked about the brain and what it does during sleep, but what happens during the rest of our body? When we sleep, it is repair. You sleep to repair. So when we repair, our heart system, all our organs get rid of what they've had to produce by functioning during the day. And again, if we don't repair, we're going to lead to chronic inflammation. That leads to depression, low energy, headaches, heart disease, lowered immune system, decreased metabolism. So I kind of think that I'm sure are starting to see that in any of these pillars, if they are out of whack or one of them is out of whack, the cascade effect that can occur along the rest of the pillars. So in what I do daily, I do see a lot of patients that say to me, well, I get 7 hours of sleep a night. I don't understand why I'm tired because I do get 7 hours of sleep a night. Well, they may be getting the quantity, but what about quality? So there's two aspects of sleep that you want to make sure are balanced. Quantity, we talked about 7 hours. Quality, we have to make sure that our sleep is restful sleep. So what is the cost of having poor quality sleep? Well, we're increased fight or flight. So in someone who suffers from obstructive sleep apnea, what's happening? They're not able to breathe at night. If you are holding your breath, if I ask you to hold your breath now, you are going to take a gasp for air over a period of time because your body's going to get stressed that you're not breathing. Well, at night, that holding of your breath happens for longer periods of time because you are sleeping, your body gets very relaxed, and then you might gasp for air. Your body, again, is stressed because it's not getting enough oxygen, you're not breathing, and what does that fight or flight do? Sets up the inflammation response. We then lead to decreased brain function, decreased mood, decreased energy, decreased metabolism, and then a decreased desire for healthy foods because you're then trying to eat high carbohydrate diet for that energy or increase your caffeine consumption. So again, 7 hours of sleep, but it has to be good quality sleep. So before we touch on this slide, I do want to touch on if you do feel that you get 7 hours of sleep, but you are still tired during the day, that is an immediate sign that you need to be talking to your physician about, do I have a sleep disorder? Am I in bed 7 hours, but am I not getting the quality of sleep that I need? There can be many things, not just obstructive sleep apnea. There's different types of sleep apnea. There's central, there's mixed, there's unclassified. There's restless leg syndrome, there's insomnia, which of course is going to be prevention of sleep or not able to sleep. All of these play a part or can play a part in decreasing your quality of sleep. So 7 hours of sleep, if you feel confident that you are sleeping 7 hours, but you are still tired, I urge you to please talk with your physician about having some sort of a sleep study done to have your quality of sleep evaluated. So the next thing to do is we need to prepare to repair. So you wouldn't go to the gym to do a big workout without stretching. So kind of think about your sleep routine or your routine before going to sleep to be your preparation. Several things need to happen, and all of us probably could say that we cut at least a couple of these short. We talk about this, the name for this is sleep hygiene. And it is really a thing because we do have to set our body up for good quality of sleep. So the first thing you want to do is create a good sleep schedule. You want to make sure that if you want to be in bed by 10:30, this is kind of how I talk to my patients and think about it. If I want to be in bed by 10:30, asleep by 11, I'm going to start preparing for sleep at about 9:30. which means that I'm shutting off all my screens. It means that I'm starting to decompress. We've got a picture here of give yourself a buffer before bed, maybe doing a meditation or doing yoga, just kind of sitting thoughtful, praying. Those types of things are going to help just calm your body, de-stress. When you decrease that stress, it becomes easier to go to sleep. You want to stay on as consistent of a schedule as you can. You want to reserve your bed for sleep. So my daughter has a habit of doing her homework sitting up in her bed, which I tell her this is not a homework space. It is your sleep space. You don't want to equate your bed with anything stressful. Doing homework can be stressful. So pull any of that out of your bedroom and reserve your bedroom for calm and sleep. As stated earlier, alcohol and caffeine can affect your sleep. I have had patients that say they have 2 whiskeys. I remember one particular person said, I have 2 whiskeys every night before I go to bed. Yet he had severe sleep apnea. I tried my darndest to say that alcohol is causing more of a relaxation, which is increasing increasing the severity of your sleep apnea and consequently decreasing your quality of sleep. We treated his sleep apnea, but he did not give up his 2 whiskeys at night, which, to be honest, I think we could have gotten a little bit better response had he been able to do that. Exercising regularly is going to have a physiological effect on your body, which is going to make it easier for you to receive good quality of sleep. Smoking, obviously, the fact that the nicotine sets up an inflammatory response. Inflammation can occur in the back of the throat, which will lend itself to obstructive sleep apnea, as well as, again, an unhealthy lifestyle and decrease in your quality of sleep. So, the 6 pillars of your healthy lifestyle. If we can increase the positive effect or a positive lifestyle in each of these 6 areas, we actually can flip the switch on our genetics. Everybody says, well, it's just in my genes. It's just in my genes to have heart disease. It's just in my genes to have diabetes. Actually had a patient the other day, interestingly enough, that he suffered from a heart attack. And about a short period after his heart attack, his mother passed away from a heart attack. He then started to see a lifestyle medicine coach. They started delving into his genetic makeup. Yes, is he predisposed to heart disease? He is. However, they were able to give him a plan to incorporate into his daily life to sort of help negate that gene that predisposes him to heart disease. So can we always flip the switch off on our genetics? No. But can we decrease the negative effect of what our genes are setting up our body for as far as illness or inflammation or not working properly? Yes, we can. And we can do that by visiting each of these 6 pillars and making good choices on a daily basis. So, our word for the day, inflammation. I hope you can see how positive effects of a healthy lifestyle can decrease inflammation, and how poor choices and an unhealthy lifestyle can affect inflammation from many angles, therefore setting us up for disease. So my take home today is try to turn off your faucet. Don't be just mopping up the water on a daily basis, but really try to go to the source of what is causing you to be unhealthy or what is causing you to suffer from chronic illnesses, and try to decrease your lifestyle or your lifestyle habits that are increasing to the poor health, so you can lead a longer, better quality of life. Thank you.
Thank you so much. I did allow the microphones again, so if anyone would like to ask a question through the mic, they are more than welcome to. If you'd like to put a question in the question box, you are more than welcome to. But I think that was a great reminder for us all. And as a reminder, Go ahead.
I have a question. I have trouble wearing my CPAP. I've had it for years, so I end up not wearing it. And one of my colleagues said that there was something that you could get a dentist to do. Can you address that at all?
Absolutely. That's what I do every day. And is my passion. So when you suffer from sleep apnea, basically you stop breathing at night. There's the collapse of the airway in the back of the throat is the main reason that causes your breathing to stop. So as you wear your CPAP, I equate a CPAP to a leaf blower for the airway. You've got, as you know, you've got the mask attached to that machine, and the machine just forces air through your entire airway to push out anything that's in the way, keeping that airway open. A lot of people, such as yourself, have a difficult time using it. So what I do is I fit people with a dental device, and it's basically an upper mouth guard and a lower mouth guard that has some sort of an attachment on the side that stabilizes the jaw in a forward position. When we stabilize the jaw forward, we prevent collapse of the airway in the back of the throat. So it prevents your tongue from falling back into the airway. It prevents all that tissue that's in the back of the throat from collapsing in and closing off that airway, consequently leaving your airway open so you can maintain adequate breathing while you're sleeping. And that's 100% what we do at Pittsburgh Dental Sleep Medicine. We have 6 providers. We have 3 offices in the Pittsburgh area, and all of us are board certified. And there's 5 doctors here in Pittsburgh. One of us has a general practice and does dental sleep medicine part-time, but the rest of it, the other 4 of us, it's what we do full-time every day, all day. So Pittsburgh Dental Sleep Medicine, like I said, is where I practice. Reach out to us. We'd be happy to guide you through the process of looking into an oral appliance. But treatment, my biggest thing is that treatment is basically mandatory for you to have a good life and healthy lifestyle. You need to make sure your quality of sleep is good. And so that is what we do, is help people who can't use a CPAP.
Do you have to have a copy of the last sleep study?
Yes, we do. And we work very closely with your physician. So we can guide you through that process, but we would ask for your physician, we would reach out to their office, get a copy of your recent sleep study. In order to get an oral appliance, you also need a prescription from your physician. So all of that, again, it's an oral device, but we are treating a medical condition. So we really do work hand in hand with your healthcare providers.
Thank you.
Does anyone else have any other questions?
You hear me?
Yes. Oh, you hit mute again, but we did hear you before.
Which works better, the oral device or the CPAP?
Ooh, that's a very loaded question. So no treatment is going to work that you don't use, right? So the CPAP is the gold standard. Any physician will tell you that. If I have a patient walk in and they're looking for an oral appliance, but they are very compliant with their CPAP and they're using it 6, 7, 8 hours a night without a problem, I would never talk them into an oral appliance. I'd say stay on your CPAP. In my opinion, if you are using a CPAP, but you're ripping it off in the middle of the night and you're using it less than 6 or 7 hours, and you are fitted with an oral appliance and you are sleeping 7 or 8 hours with your oral appliance, you are better off with the oral appliance. There is research out there. There was a big study that came out in 2013 that took CPAP wearers and oral appliance users, and the health benefits of the oral appliance and the CPAP were equivalent, because people who wore the oral appliance used the treatment longer hours a night than someone who's on a CPAP. Now, Medicare and insurance companies will continue to sort of pay for CPAP supplies and so forth as long as they see you using the CPAP more than 4 hours or more a night. However, from a health standpoint, if you have obstructive sleep apnea and you're only treating it for 4 hours a night and the other 3 or 4 hours, so almost half the night, you're not breathing properly, what are you doing? You're setting up a good inflammatory response because you're not breathing. And most of the time we hit more REM sleep in the early morning hours, 2, 3, 4 o'clock in the morning. Most of the time people go to bed with their CPAP. It comes off at about 1 or 2 in the morning. And so then you're getting that REM sleep where your body's most relaxed. You're suffering from probably the most occurrences of sleep apnea and you have no treatment. So that's kind of a long-winded answer to your question. I guess the short take home is if you are using a CPAP and you're compliant with it for 6, 7, 8 hours a night, stay on your CPAP. People who are not using their CPAP for the majority of the time that they're sleeping and we put them in an oral appliance and they're able to wear the appliance all night, their health benefits are equivalent to those people who are using a CPAP for about 6 or 7 hours a night. That answer your question?
Well, it does, but then I ask, why don't people go to the oral appliance first?
Because, yeah, that's a great question. So, because CPAP is the gold standard and physicians, they want people to try the gold standard and again, because people that would be successful with the CPAP may be missed if people just went right into an oral appliance.
So the CPAP works better than the oral appliance, and the oral appliance is effective only if the CPAP is worn for too short a time.
Yeah, that's basically, again, it's because in order to receive that quality of sleep, you have to have that airway open, ideally for the entire time you're sleeping. So if the CPAP is going to blow, they're going to set those pressures on a CPAP at an adequate pressure to maintain that airway open. So that whole time your CPAP's on, it's going to be blowing air and opening that airway. The oral appliance only affects the back of the airway in the back of the throat, which is where most of the collapse happens. And it may not, because of anatomy back there and the anatomy of the jaw, and it gets very intricate, but it may not be able to open that airway as much as a CPAP. However, something is better than nothing. And so if you can't tolerate a CPAP, an oral appliance is really the next best choice. And there's a lot of people that have anatomy back there that it's easy to open the airway. So it gets pretty, when we see people, we do a pretty detailed exam of the mouth and the back of the throat and the tissues, because there are some people that come in and their tonsils are practically touching. And I'm like, I'm not going to put an oral appliance in there and successfully probably open that airway because those tonsils are huge. So we may put the oral appliance in, but then we refer them also to have their tonsils evaluated for removal. So there's a lot of anatomy back there that gets pretty intricate.
Okay, thank you. One final question. How about the implant device you see on TV as an effective sleep assistant device?
So, in my opinion, the verdict is still out on that a bit. Right now, they are very stringent on the people that qualify for the Inspire. So if you check the boxes, then you're a candidate for Inspire. And I have to tell you, I know people that like it, and I know people that have had it implanted and don't even ever turn it on because they just don't like the way it makes them feel. I don't know if you know how it works, but you have an implant kind of right here, right in your shoulder area. There's a wire that goes up to your hypoglossal nerve and basically stimulates that nerve when it starts to sense that the tongue is dropping back into the airway, sends a shock to the tongue, and then the tongue kind of jerks forward. Some people need a pretty significant shock in order for that tongue to jerk forward, and it's uncomfortable. So I think the verdict is still out on that. It's pretty new, and I just now am hearing people get into that type of treatment. So I'm going to kind of sit back. Right now, I would not recommend that as a first or second line of treatment.
Good answers. Thank you very much.
Mm-hmm.
Does anyone else have any questions? All right. Well, thank you very much for your time. It was an excellent presentation. I know I learned a lot. And for everyone else, we did record this session, so we will have the link available. And if you do need anything, feel free to reach out to me. I will put my email in the chat box right now for you. And if you have any other questions, please feel free to reach out as well. But thank you all so much for your time and attending. And again, our next sleep group is March 2nd, and we're going to be doing, it was a nice follow-up from this presentation because we're going to be working on relaxation techniques.
Yep.
So,
Perfect.
again, thank you all so much, and I
you.
hope you have a lovely day. Thank you.
Bye.